Hey y'all, it's Dr. Lakeisha Watson, epidemiologist and data storyteller, translating data into health insights for Black women. Welcome back to Epi Fridays. Today we're talking about environmental justice in the air we breathe. So let's get into it. So here's something a lot of people don't know. Even when income is the same, Black families breathe dirtier air than white families. Yes, something as basic as taking a breath can be more dangerous just because of where we live. And that's not just an individual problem, that's a public health issue. Now let's talk about why that is. Across the country, many of our neighborhoods are what researchers call fence line communities. That means homes, schools, and playgrounds are sitting right next to industrial plants or refineries, sometimes separated by nothing but a fence. And when we zoom in on who lives in those areas, the pattern is clear. They're often predominantly Black and low-income communities. People in these neighborhoods are exposed to pollution every single day. Diesel from highways, chemicals from factories, or soot from power plants. And over time, that daily exposure adds up. It contributes to higher rates of asthma, heart disease, and even pregnancy complications, conditions that already disproportionately affect Black women. Black adults are 40% more likely to have asthma, and Black children are 8 times more likely to die from it. And that's not genetics either, that's geography and policy at play. And here's where it gets personal. Black women are more likely to live near pollution sources, and that exposure has been linked to heart disease, pregnancy complications, and even breast cancer. And we're also often the backbone of our households and communities, right? So that means caring for families, managing stress, working multiple jobs. And when the air itself is working against us, it compounds those pressures in ways that data alone can't fully capture. So when we talk about environmental justice, it's not just an abstract issue. It's a Black women's health issue because our environment shapes our bodies, our stress, and our survival. Now let's look at what the numbers tell us. According to the EPA and the NAACP, Black Americans are about 1.5 times more likely to live near oil refineries, landfills, or power plants. And that's not just statistics, those are our neighborhoods, our homes, our schools, the parks where our kids are supposed to play safely. And in Louisiana's Cancer Alley, a stretch packed with over 150 chemical plants, mostly Black communities, face some of the highest cancer rates in the country. And our kids, they're 5 times more likely to miss school because of asthma triggered by polluted air. This isn't random, y'all. There is a reason these patterns exist. So why does this matter? For decades, policies like redlining and industrial zoning determined where Black families could buy homes. And too often, those areas were carved out right next to factories, highways, or waste sites. Those policies didn't just shape neighborhoods, they shaped health outcomes across generations. That's what we mean when we talk about environmental racism. Systems that concentrate pollution in Black spaces while protecting others. And the truth is, it's not just about air quality, it's about equity, access, and the right to live in environments that don't make us sick. Clean air is not a privilege, it's a basic right. And organizations like the Louisiana Bucket Brigade, Black Women for Wellness, and We Act for Environmental Justice are leading the fight to hold polluters accountable and protect communities. You can support their work, share their research, or even start small by learning about air quality in your own neighborhood. The EPA's Air Now website is a good place to start. All right, y'all, I am Dr. Lakeisha Watson. This has been Epi Fridays, and I will see y'all next week.